Welcome to today's Spotlight series. My name is Dr. Tejal Ramaiya. I'm a physical therapist and owner at Body Moksha Physical Therapy in Chatham, New Jersey. And today we're here with Dr. Meredith Irwin, who is owner of Little Nest Pediatrics in Chatham. She's an expert in pediatric medicine and child development. And Dr. Irwin, welcome to our show. And thank you so much for being here. She's going to tell us all about her practice and what makes it so unique. So tell us a little bit about just firstly, what made you decide to be a pediatrician?
Oh, wow. What made me decide to be a pediatrician? I've always wanted to be a doctor since I was a young kid. And in college, I did toy with physical therapy for a hot minute, but then I went back to the medical school idea. And when I started medical school, I wanted to be a geriatrician. I had
Wow.
a lot of experience working in nursing homes in college and with elderly people. My dad always worked in nursing homes, so I was exposed to that. And when I was doing my rotations, I really fell in love with pediatrics. There's a lot of similarities in those two populations. Health wise, and then also the dynamic of taking care of them. You with elderly people, you often are dealing with their children, and then with children, you're dealing with their parents. So
Parents.
I had an attending in medical school who was like, do you want your patient relationships to end with the patient's death, or with the patient going on to live a wonderful life?
That's
And
interesting.
yeah, so I took that into account. That really stuck with me. And then also, I really loved the attendings I worked with in geriatrics, but I really felt like I vibed more with the pediatric staff, the nurses, the other
Yeah,
doctors. I felt like they were more my people, and so that was another reason that I chose pediatrics, and here I
very
am.
cool. That's
Yeah,
awesome. That's really interesting. Like, I never thought that it would be like a similar type of, you said there's a lot of similarities in seeing both
yeah,
geriatrics and kids. And that's true because like a lot of them are in both ways, they're dependent on someone, whether it's their
right,
parents or their kids or yeah.
right.
So what I know that you did regular traditional pediatrics before, and then you transitioned into more of a concierge model, which you currently have. So tell us a little
Yes.
bit about your practice just overall. And like tell us a little bit more about the concierge model.
Sure. So when I was deciding to go back to work after I moved to New Jersey from Kentucky, which I did in 2022, I was kind of deciding, do I want to go back to traditional medicine, which I had done for 8 years in Kentucky, or do I want to try something different that might fit my family's lifestyle a little bit better and give me flexibility? And this model really does that so well, for myself and my family, but then it also provides exceptional care that I think everybody would really love to have from their pediatrician. So in this model, it's called direct primary care. So in direct primary care, we don't deal with insurance at all. Patients just pay me directly, and then that's it. It's very simple. There's no middleman. With the true definition of concierge is usually you bill insurance and then also take a monthly membership fee for that kind of concierge level of care. So
Okay.
it's a little more complicated. I didn't want to deal with insurance at all. I just wanted to be super simple, like old
Mm-hmm.
fashioned. Before insurance was a thing, people went to their doctor and paid in chickens and eggs or whatever, and whatever they could
Yeah.
do. I wanted it to
Yep.
be like that, very simple. And so that's what patients do. They pay me directly a monthly membership, and that gets them access to me, my phone. They can call, text, email me whenever. I am available to them always. I can see people after hours on the weekends, kind of be as convenient as possible for them. And my patient population is smaller. So the average pediatrician in a traditional practice has about 2,000 patients.
Wow.
Yeah.
That's a
And then
lot.
if you're working in a practice with 5 doctors, for example, there's going to be 10,000 patients, and you're going to see some of those other kids too. So when you go to see the doctor, the doctor probably doesn't really know you.
Sure. Yeah.
They're looking
No,
at
I
their
agree.
computer but they
Right.
don't, you know. So I know all of my patients very well. I know their parents' names. I'll admit, when I was practicing before, I never knew parents' names. They were always mom and
Yeah.
dad, and now
Right.
we're on a first name basis. I know the whole family. And um I'm just providing that super personalized experience for them.
That's amazing because like as
Yeah,
a new parent, like you're so unsure of so many things of like what's normal, what's not normal, like what's going on to be able to like, and this was not, I think I've told you in the past, like this was not really an option that I knew of when my kids were babies. And to
right.
have that at like my fingertips would have been amazing because I remember sometimes just like, I don't know what to do. Like, is this normal? Like my daughter just spit up. Like, I don't know what's going on, but it's
Right.
scary when it's your first kid.
Yeah.
But yeah, it's an amazing, amazing option, I think, for new parents. And can you tell us a little bit about, I think that most people might assume because it's not covered by insurance, like that the pricing might be out of their reach. Can you tell us a little bit about, and I know that I've talked to you about this in the past, and I do feel like it's very affordable for what you get. Tell us a little bit about that.
Yeah, so the monthly membership is based on age. So infants 0 to 12 months are my most expensive population, just because I do house calls for the first 2 months. I don't make the parents come into the office. The mom's recovering
It's
from
amazing.
delivery. So I come to them, which is a lot of fun. And then they also are seen very frequently in that first year. So that's $250 a month for babies. And then 1 to 2, they also are being seen quite frequently. That's 200 a month. And then everybody beyond that is 150 a month. So I think that it's, a pretty affordable, especially when you're considering you're not paying any extra copays. And I'm keeping you out of the urgent care or the emergency room as much as possible. Of course, some things are always an emergency no matter what. But,
Hmm.
there are lots of things. I had a mom once reach out to me on a Sunday. She was like, so and so woke up from a nap and he acts like maybe he has an ear infection. Should we go to the emergency room? I'm like, are you kidding me? No, I'm going to see
That's like
him. Like,
amazing.
yeah, like you're not going to go to the emergency room for that or urgent care or whatever. And you never know what you're going to get at those places.
And how long
Especially
you're going to be there
how
for.
long you're going to be there, how many germs you're going to be exposed to, is the provider experience with children. Kids aren't just little adults. So a lot of people, nurse practitioners or other doctors, are not, as equipped to evaluate a child. So in my practice, you're always going to see me, and I'm going to be able to see you most of the time on a Saturday
Hmm.
or Sunday if you need. And so I think in the long run, I'm saving people money that way, or it's at least balancing out to be even. I
A
do
hundred
use
percent.
insurance to pay for vaccines. So insurance isn't like useless for patients. We use insurance to cover vaccines, and then any labs that I might do out of the office are also going to be covered by
Oh, that's
insurance.
convenient too.
Yeah,
That's
I
really
do. I
convenient.
do a lot of labs in the office, all of your basic, like, flu, COVID, strep. I do a couple of blood tests, urine. That's all in the office that I can do, and that's all included in the membership as well.
Now, do you have anyone who's also working with you a little bit just to kind of help you with certain things?
Nope, it's just
No?
me. At this
Okay.
point, I'm
That's
still able
amazing.
to do it all myself. If I get to a point where I'm feeling overwhelmed and can't manage it, then I will happily look for some help. But at this point, I can handle
That's
it all. So
amazing. Well,
yeah.
because then you always also know what's going on. I remember when my kids were little and I had to take them to the emergency room for two separate things. Like my son had like a really bad stomach bug and like I ended up taking him to the ER because I was like, you're dehydrated. And I mean, being in the medical profession, like I knew what to look for, but I don't know if everyone knows that. But like to be able to call a doctor and say, this is what is happening. They could have told me to go to the ER, but also like, being able to know that I was just like super nervous about what could be going on. And then you're
Sure.
also there for hours. Like I was there, I remember my daughter had a really bad sinus infection. she must have been like 2 years old. We were there for like 4 hours.
Yeah.
But to be able to avoid that, like, oh, it's so amazing.
Yeah.
Um, so you probably already touched on this a little bit, but just the way that your practices and like, just overall pediatricians are just so important in parents' lives overall, especially like in those younger years. What sets you apart from other pediatricians in your field outside of the concierge model or the direct care model?
Sure. I do have a special interest in behavior and development, which I know is a really um not hot topic. Well, I guess it's a hot topic. I don't know. But a lot of people deal with, behavior issues or concerned about, certain quirks that their child might have. I was trained in my first job to diagnose autism in children from 18 months to 3.5 using this particular testing tool. It was like an initiative of the state that I was working in. And so I got very comfortable recognizing those kind of symptoms. And in this model, I have the time to really observe a child and like really kind of know what's going on. Um, so I have that background, which I think every pediatrician does not necessarily have that background. And then I'm also, a mom. If you have a pediatrician that's not a parent, they don't know what they're talking about. I feel like I did
Yeah,
it before. I mean, I practiced for like 2 years out of residency before I had my first kid, and oh my gosh, some of the things I would tell parents. I mean, they were like by the book, they were textbook, but it's
right.
like that. It was just so out of touch.
Yeah, well, sometimes
um,
like the practical knowledge of just if you can, I guess, put yourself in the parent's shoes and like, yeah, it's just different. It's
it
different
is.
because you
It is.
understand what the
Yes,
parents are going through. Yeah,
exactly. Exactly.
right.
Yeah.
Oh, that's really interesting. So, in terms of like, who would be an ideal patient for your type of practice, an ideal family for your type of practice, can you tell us a little bit about that?
I think there's a lot of ideal families, especially new parents, first time parents. I think that I'm really a good fit for because I'm available and can answer all of the questions, which there are a lot typically. I'm also a good fit for two um, working parent households. They're so busy, and you might not always have time to run into the pediatrician for every sneeze or cough or whatever. A lot of times we can take care of things over the phone in my practice, or again, like I've mentioned, I'm happy to meet after hours and things like that as well. So there's that convenience factor. And then families that have more children with more complex needs as well. Even older kids, children with issues like ADHD or some depression, things like that, people that need kind of more frequent check-ins with their pediatrician. I think that I'm a good fit for those families as well.
So do you work with, you mentioned depression and ADHD, do you work with other behavioral specialists or psychiatrists or like how do you work with other providers to collaborate?
I do have some connections in the community for more complex cases that I can reach out to. In my first job in southern Indiana, just right across the river from Kentucky, um, I worked in a really it was a diverse population, a heavily Medicaid insured population, and the resources were just not there. So I got so much education and experience in treating things on my own, or in collaboration with the other doctors in my practice, um, because we were the only option. A child
Wow.
was
So
struggling.
that's,
You can't send them
yeah.
to the psychiatrist. There's not maybe a year down the road they could get in with a psychiatrist, but there just wasn't an option. So we just had to do it. And I think a pediatrician that won't treat any level of medical or of mental illness needs to do some work and some education. Of course, there are certain cases that are beyond my scope, but there
Hmm.
are certainly very we call bread and butter cases that I think that any good pediatrician should be able to handle.
Well, that's a good point because these days I feel like everything is so specialized that like having to go to multiple doctors for different things when it's something that, like one doctor can easily learn.
Right,
I think it's I mean, just another generalization. Like, I think all OBGYN should be really well versed in menopause treatment. At
right.
least, someone's in perimenopause, like, because that's something that is part of women's health. So, just like that, I think mental health is such a big part of kids and teens that I agree with you. I think it's being able to like at least have a conversation with your pediatrician can put a parent at so much ease rather than having to figure it out separately. So
Right,
that's really
absolutely.
helpful.
Yeah, I tell parents, I have my toolbox. This is what's in my toolbox as far as like medicines and things. And if we go through the toolbox and we've used everything and we're out of tools, then we go somewhere else. But I think
Hmm.
a pediatrician should always be the first stop. Like I said, I think any good pediatrician should be able to manage at least the most basic of those issues.
Right. No, I agree. I think that's really, really amazing. So, do you do any type of like well, I guess some of it is also preventative. Like traditional Western medicine is not really preventative care, it's more reactive care outside of, I guess, vaccines. Do you do any type of like preventative care or wellness or anything like that also, or not so
I mean,
much?
every checkup is preventative care. In addition to the vaccines, we're doing, we call it anticipatory guidance. So, telling parents, okay, this is what we can expect for their development over the next 6 months before I see you again. And here are some things that you can do to encourage those developmental milestones to,
Oh, awesome.
so I think a big part of pediatrics is preventative medicine. And then, of course, we're always counseling on diet and things like that. That comes with every checkup
Oh,
as
that's
well.
good.
Yeah, absolutely. I mean, I was board certified. I guess I didn't mention that this also kind of sets me apart. I was board certified in lifestyle medicine during the
Wow.
pandemic. Um, and it is kind of what it sounds like. It's all about the importance of lifestyle in promoting health and how you can really manage a lot of chronic illnesses like diabetes and high cholesterol and heart disease and all of that stuff with diet, exercise, avoiding smoking, alcohol, having social relationships, all of those things, and how kind of important that is. So that is always a big part of what I talk about with families too.
Oh, so a little bit of a side quest. Is that, I haven't heard of that as a specialty. So is that something new?
It is. It's not an ACGME like recognized specialty. Like you can't do a residency in it. You might be able to
Okay.
do, I don't know, some fellowships or something in it, but you can't come
Okay.
out of medical school and become a lifestyle medicine doctor. It's
Okay.
kind of an additional
It's like a
um,
layer.
yes, exactly. It's
Yeah.
just like extra education. And one thing that sets it apart is putting an emphasis on plant-based nutrition, which is unique to, I mean, in medical school, despite what some people in the government like to say, we doctors are taught some about nutrition and the important, of course, it's important to exercise and eat healthy and that kind of
Mm-hmm.
thing. But this is like a bit of a deeper dive into the nutrition aspect of things, and especially putting emphasis on plant-based nutrition um, is there. So I got a lot of education in that.
Oh, that's really cool. Because I
Yeah.
feel like a lot of parents that I talk to do struggle with just with their kids eating, whether it's
Yeah.
when they're at a young age, like my kid's really picky, or when they're older and just eating disorders become something that become very prevalent, or like a lot of kids who are in sports, which is like pretty much every single kid around here, like just what's the proper nutrition to support their activities and the amount of training that they're doing. I feel like that's a really big part of and my kids are not at a direct care pediatrician, so like just comparing like, you know, a traditional pediatrician will generally ask like, are you eating okay? Like what are you eating? And are you eating protein? They'll kind of just check it off the list, but there's not a lot of like coaching or guidance on that.
Right.
So it sounds like you have a little bit more deeper conversations about what would be good for someone like an athlete in high school?
Sure, yeah. And
Oh,
I can't say that I know it all off the top of my head,
right.
but
Of
I
course.
have in this model I have the time
Yeah.
to go and read about it and like look things up for a specific person and give them information about what they should be doing.
Yeah. And just kind of pulling that into what we do as physical therapists, we see a lot of injuries, and a lot of the kids' injuries can be prevented by proper protein intake and carb intake. So I think that's a big conversation to have with, and even like the adults that we see, like the recovery, a lot of the recovery is based on like, are you eating enough? Like some people just might not recover well because they're not sleeping well and they're not eating well because that's
Right.
what your body needs to improve tissue integrity. So we talk about that a lot too. It's such a big part of it. So that's really cool that you have that board certification in that. That's awesome. So if someone was going to work with you, how does that generally happen? Do they find you on Instagram? Do they find you online? How do they reach out? What's the
They can,
process from beginning
yes.
to becoming a patient?
Sure. The simplest thing is to go to my website, and I think it's on every page. At the top of the page, you can click on a link that says request a meet and greet. And it's just a quick, simple form, just a few questions. And when you send that to me, then I will reach out with an email and we'll set up a time to talk. I meet with everybody before we decide to partner together.
Hmm.
And it's about a 30-minute conversation. They can ask me anything about the practice or about myself, and I find out about their family, and then we decide if we'd be a good fit together. And then I send a link to register, and they register. It's pretty simple after that. Um, and then I can see kids, the same day that they register if they need to. Then we work
Wow.
on getting records and things like that, but that doesn't inhibit me from seeing somebody, if necessary.
Awesome. And then do they make their like next appointments when they leave their current appointment, just so that they're, especially with the babies, because they're coming like at regular intervals?
Sure. What I usually do is what has been working so far is I set a reminder in my system to reach out to them like a week before they're due for their next appointment, and then we set
Hmm.
up a time.
Okay.
My schedule is really so open and available, so you don't have to schedule a month, 2 months in advance. You could schedule on a Monday to get a checkup on a Wednesday.
Well,
It's
that's
not.
also so convenient because I
Yeah.
have to schedule my kids' appointments like 3 months ahead of, like, I have to set a reminder at least 3 months before to make an appointment for when I need
Right.
it.
Right. And then if they're like
Yeah,
sick or something, if they have to miss it for some reason, then you're like, how are we going to get back in? Like,
I know. That's
yeah.
true. That happens all
Um,
the time.
yeah. And people just text me. I'm one of those people that when they need to make an appointment, they text me and we just set it up that way.
That's
I'm one
convenient.
of those people that like, if I get a text, I have to answer it immediately or because one, I'm going
Yeah,
to forget about it
forget.
and it just
Same.
like bothers me. So, for better or worse, I respond to people very quickly. You could ask any of
Yeah.
my patients, like they're always like, you don't have to, it's Friday night. You don't have to respond anytime soon. And like I answer like, I'm
I
sorry, I'm gonna
know.
do it.
I
Yeah,
know. And I do that too, just because I know I'm going to forget. Either I
exactly.
can respond to them or I can make a note to respond to them. So, like, I'm like, I might as well respond to them.
Yeah, exactly.
Yes. But also, like, I know that I've gotten stuck in situations where my kids had to have a physical before sports started, and I couldn't get an appointment with the doctor. And it was like, how am I going to get this physical form? Otherwise, they can't do like some fall soccer. So, like,
Right.
to be able to get an appointment right away is
Hmm.
so unheard of and so convenient.
Right.
So just I'm just wondering if there's any, misconceptions out there about like direct care type of model. Are there any misconceptions that people might have about a model like this?
One thing that I've come across is people wondering if I can prescribe medicines like any other doctor, since I don't
Mm,
like partner with insurance. I'm not, credentialed by insurance. And no, I can do whatever. I'm licensed, board
mm-hmm.
certified. I can do anything your general pediatrician can do. We're so used to jumping through all of these hoops and doing these having these protocols, like if you ever schedule a checkup a little too early, if it's not been a full year, insurance might not cover it,
Right.
and so then every year it like gets a little later and a little later. That's how it is for my
Exactly.
own personal doctor.
Yes.
But here it's like there are no rules like that. We make the
Yeah.
rules. If you need a checkup now a week before they turn 7, then we'll do it, and they're almost 7,
Mm-hmm.
who cares,
Yeah. Mm-hmm.
so um yeah, so I think it's hard to get past the what has been so ingrained in us is the way things are supposed to be done. They don't have to be done that way.
Right.
We can make it very simple. So that's, I think, a misconception. And then also that it's, a waste of money. That insurance covers all medical care, so why would you pay extra for this? And like I mentioned earlier, I think it does save money in the long run, with no copays and no hospital, fewer hospital visits, fewer urgent care visits, and that kind of thing. And there's value to it as well. It's just a great relationship that you have. It's like having a sister who's a pediatrician. That's how I
Right.
kind of look at it for my patients. They can reach out to me. They know they can reach out to me whenever they need.
No, I completely agree with that. The fact that you are available all the time to be able to answer questions all the time via text, which is like one of the most convenient things to be able to get in to see you right away. All of those things I think are just a big, big, big. It's just like so much value that it
Yeah.
makes it so much worth it. So we talked a little bit how you collaborate with other practitioners and things like that. So you have like, do you ever do anything in the community to connect with other parents or, just getting the word out about your practice?
Yeah, I mean, I've tried to do little events here and there. I would set up a booth at the Fishwack Festival in Chatham this
Oh,
spring, but
right.
it rained all day. So I
Oh,
didn't
it
connect with
did?
as many. Yes, it was terrible. I didn't connect with as many people as I wanted to. I did a little event last week at Creekside Farm. There was I don't know, there were probably 40, 45 kids and their moms there, with a group called Little Local Magic. And that was fun. Got to meet some local moms. And then I'm doing
Mm-hmm.
a chat with Take a Moment
Mm-hmm.
in November. I'm doing a session with them,
Awesome.
yeah, just kind of, I think, do a Q&A with the moms. So
Mm-hmm.
I'm getting out there and trying to
Connect
meet
with
as
other.
many. Yeah, exactly. Exactly.
Nice. So what would you say is like the most rewarding thing about your job?
Oh my gosh, getting to like take care of these little humans. I just love it. Oh my gosh, I just love it. They put a smile on my face, and I get to hopefully make coming to the doctor's office a positive experience for them. I have one patient who, the first time that he came here, terrified, like would not even get on the scale, like so
Oh,
scared, and then saw him again a few weeks ago, and he didn't want to leave. So it's
yes.
amazing, to get kids more comfortable with the medical atmosphere. And even though the office doesn't feel very medical, because I try to make it, as you can see, very fun and
Mm-hmm.
colorful and anything but doctory. So yeah, I just love it. I love taking care of the kids and getting to know them, and supporting
Yeah.
the parents too.
Well, also, one big thing that I've noticed is just based on what you've been saying, is it sounds like it's more relationship based and like, going to the pediatrician with my kids seems more just like very transactional. We go in, we do the appointment, we leave, okay, everything's fine, whatever.
Yeah.
Like the doctor doesn't know me, they don't really know my kids, they just checking things off the list. Like that's huge for kids who are, especially kids who are dealing with like autism or behavioral issues. Like you need to be able to connect with the child to be able to help them thrive. So I think that's a really big part of, I mean, what you do overall. I think it's good for everyone. Like I'm wondering how it would be different for my kids if they had a different relationship with their pediatrician,
Right.
even
I
though they're
loved
older,
my
but
pediatrician growing up.
yeah.
I went to a practice with several doctors, but there was always one that I just loved so much, and have, positive experience with that. And I don't know, I think that that's just sets you up for success as you go on through life and encounter the medical field and hopefully take some of that anxiety away,
Yeah,
even
for
as a
sure.
grown up. Yeah.
And it might even inspire them to be go into the medical field, which I think is
Right.
like amazing.
Yeah.
Yes, because they've
Yeah.
had such a positive experience. Is there anything else that you want to share with us that we already haven't talked about?
Um, I pierce ears.
Oh, that's
So I,
that's interesting because a lot
yeah,
of pediatricians don't do that anymore. So that
yeah.
also sets you apart from most pediatricians.
Yeah, and I do that for non-patients as well. So you can find that
Oh,
information on my website. Yeah, that's been a fun little side gig to
oh, that's
do.
funny.
Yeah, I'll
Yeah, that's
pierce
very cool.
all the way down to 2 months old,
Okay.
because especially some cultures pierce very early,
Mm-hmm.
and so I wanted to be able to do that because I know that's not an option in a lot of. You can't go to Claire's with a 2 month old and get your ears pierced.
Yeah. Right.
Um,
It was, I think, a hard thing to figure out where to go because a lot of doctors stopped doing it.
Right, exactly. And I use equipment that is, you can only get if you're a medical professional. So you have to be a nurse or a physician. It's, completely sterile. And every everybody that I've done so far has been very happy with the results. So that's a
Awesome.
fun little, yeah.
That is a big plus. So
Yeah.
do people have to come with the earrings or can they buy them from you?
No, they're part of the
The part of the kit
it's
or something?
yeah, they're part of the kit. They're
Okay.
sterile. Yeah, so it's all included. The cost for the piercing and the earrings and the aftercare is all just one package deal. And I do will come to your house to do it as well, but that is an extra,
Wow.
a little bit
Hmm.
extra fee.
Yeah.
I've not done that yet. I do have one scheduled in November to do at somebody's house. So
Very cool.
yeah.
I love it. I love it. I love it. Do you know any other pediatricians in the area that have a model like yours?
Some that are similar. So I have met a physician who, I think most of his patients are still in Manhattan right now because he used to practice in Manhattan and now he lives in Summit, and so he's starting to expand. But his model is slightly different. He only does house calls, and I think his is like an annual fee. Not I
Hmm.
People pay me monthly, and so you
Hmm.
don't have to, commit to a whole year or whatever.
Hmm.
But he is amazing, and he actually helped cover for me. I went away last spring break to Mexico, and so he was kind of my backup if somebody needed to be seen.
That's
um
awesome.
yeah, yeah.
Yeah. So
So
that's nice that you can collaborate with someone else and work together like that, especially in your type
exactly,
of practice. Very so like
exactly.
that's a good point because if you go on vacation, like what do parents do if they have a question? So yes,
Right.
that's
Exactly.
good. Yeah.
Yeah, exactly. I have been out of town a few times when he wasn't available, and I was just, available via I was still
Phone or text.
available.
Hmm.
Yeah,
Right.
exactly. And
Yeah.
of course, if somebody had to be seen for a strep test or something like that, then they might have to go to urgent care. But I lead a pretty boring life, so I'm not gone very often. That doesn't happen very
Okay.
often. Yeah,
No, but it's good to be able to like take a break when you need to take a break too. So
sure.
that's
Yeah.
good. Well, thank you so much. So if you are a parent and you're looking for someone who is having your back all the time, who's always going to be there for you, Dr. Irwin is definitely the place to go. Little Nest Pediatrics. You can follow her on Instagram. I know she's always posting awesome tips that are super valuable. It's at Little Nest Pediatrics, correct?
Yes.
Yes.
Yeah.
So it was a pleasure having you today. Thank you so much.